Hello, I am Dr. Michael Hughes. I created Vanguard Surgical to focus on improving the lives of gastroparesis patients. Having treated several thousand gastroparesis patients over the past 10 years, I would like to give you my perspective on why gastroparesis can make you or your loved one feel so bad. There are 5 main symptoms of gastroparesis. Nausea. This is when you have a sour stomach and feel as if you need to throw up. Vomiting. This is when you throw up whatever is in your stomach. This may be liquid or undigested food. If you are belching or dry heaving, this is you vomiting out the free air you have swallowed. We all swallow air unconsciously. This is not the problem. The problem is that your gastroparesis stomach does not empty normally. Early satiety. This is getting full very quickly and not tolerating a full-size meal. You may wonder why you feel so full. You can feel full without eating anything, as your stomach is full of swallowed air. Bloating. This is upper abdominal fullness. You may feel like you have a baby or a football in your belly. You may need to loosen your clothes or belt. This is because your stomach is full of swallowed air, stomach acid, and undigested food. Pain. This is pain above your belly button, usually between your ribs. It is often crampy or stabbing. Typically, only vomiting makes it go away. Very few doctors or patients understand this pain. Many do not think pain is one of the symptoms of gastroparesis. In fact, gastroparesis studies by the FDA often do not measure pain. The next slides will show you how gastroparesis can cause pain, as well as your other symptoms. Not everyone with gastroparesis suffers the same. Whether or not your stomach is blown up and under pressure impacts which symptoms affect you the most. The following pictures are images of stomachs that I've seen during laparoscopic surgery for gastroparesis. These patients did not eat or drink anything after midnight the night before surgery. Therefore, their stomach should be empty and flat. If pictures from surgery disturb you or you are under the age of 18, then please stop this video now. So, is your stomach under pressure? What you are looking at here is a stomach that is completely decompressed. This is fat coming off the stomach called the omentum. These are the left-sided ribs and diaphragm. This purple wedge is the liver that I'm lifting off the stomach. This stomach is completely decompressed and flat. If awake, this patient would likely not feel fullness, bloating, or pain. However, he or she could still have severe nausea and vomiting. This is an example of a stomach that is not under pressure. I do not often see this. Much more often I see this. This is an example of a stomach under pressure. You can see that it is blown up like a balloon. This is usually due to swallowed air rather than food. Your GI doctors may have a hard time appreciating this because they need to blow air into your stomach when performing endoscopy to create space. When performing laparoscopy, I blow air into your abdomen, not your stomach, so that I have space to perform surgery. In this case, the stomach is nice and pink, which means that it is getting good blood flow and likely would not cause much pain. Wow, now this stomach is tight like a tick. The pressure in the wall of the stomach is so high that blood cannot get to the muscles. That is why this stomach appears more dusky or purple. When muscles do not get enough blood, they cramp. Just like getting a Charlie horse in your calf when dehydrated, you can get a Charlie horse in your stomach when tightly bloated. Pain medication does not touch this. Only decompressing the stomach with vomiting, belching, or pyloroplasty surgery can make this pain go away. High pressure in the stomach activates the vagus nerve. When activated, the vagus makes you nauseated and break out in a cold sweat. It slows your heart rate and drops your blood pressure to make you lightheaded, dizzy, and even possibly faint. By decompressing the stomach, all these symptoms improve or resolve. At Vanguard Surgical, we are committed to improving the lives of our gastroparesis patients, one patient at a time. We are centrally located in Louisville, Kentucky, and take care of patients both near and far. Many of you are told that nothing can be done for gastroparesis. This is not true. Please check out our website at vanguardsurgical.net for more information. If you are interested in referring yourself, then please call 502-912-8300. If your provider wishes to refer you to us, then please have him or her fax the referral to 949-655-8616. I hope today's video was helpful. There will be more to follow.